Okay, after age 50, the U.S. Preventive Services Task Force has recommended colonoscopy across the board for everyone. In fact, I think that recommendation has now possibly been pushed to age 45. Does that make sense? Is it saving lives? That's an interesting question. So generally, their thought is more screening, the better. Doesn't matter what it is, the more you screen, the more disease you detect and thus prevent significant outcome. However, a lot of studies have shown that sometimes the screening itself can cause morbidity and mortality that exceeds the actual benefit from doing the screening. Case in point, there was concern around a blanket recommendation for mammography that you created higher percentage of procedures, i.e. lumpectomies and things like that, which had complications. And actually, the overall benefit may have not matched the risk associated with this. And I'm not sure on breast cancer if those questions still remain. But I know that recently there has been a randomized control trial on colonoscopies. There's never been one done before on this. And this is an interesting study. Dr. Vinay Prasad has done a very extensive look on this particular study. I suggest you go watch his video. It's 30 minutes long if you're interested in greater detail than what I'm going to share here. But what basically they show during this study here is that from an all-cause mortality standpoint, am I going to die or not? General screening colonoscopy for the population did not show a benefit. In fact, there might be some suggestion of a negative benefit. Now, colonoscopy, for you guys that haven't had that yet, they basically take a camera and they basically run it, introduce it from below, go up the rectum, up the sigmoid colon, up the descending colon, past the splenic flexure, across the transverse colon, down through the hepatic flexure, and then ideally all the way to the cecum. The rate of reaching the cecum tends to be about 95% of the time they're able to get that scope down there. The problem is occasionally there are perforations. The rate of perforation can run as high as just under 1% to more likely about 1 out of every 3,000 scopes will end up with a perforation. Perforation is a bad deal, carries about a 25% mortality rate according to some studies. So that can be a significant negative outcome, and it depends upon the skill of the gastroenterologist doing this procedure and what their perforation rate is. Obviously, from a liability standpoint, you perf someone's colon, there's going to be a lawsuit, you're going to pay money. However, when you look at a hospital calculation, they're like, well, how much money are we raking in from these procedures? If you think about it, the gastroenterologist's fee, the sedation person's fee, you can't, as a gastroenterologist, you can't do a procedure and be responsible for sedation at the same time. So they have to have a sedation person, maybe a CRNA, a sedation nurse, something like that, maybe an anesthesiologist perhaps running that. So they're going to bill the medication, is going to be billed for the equipment fee, and use of the facility room is going to be a fee. The recovery nurse's time and use and recovery room fee. So it becomes quite an expensive process, and there's a lot of profit to be made from that. And some people would argue that maybe their recommendations for everyone to do it is just to ensure a nice income stream. So certainly, colonoscopies have detected precancerous lesions, cancers, and have probably saved a significant number of people from, developing more cancer. So there is a benefit for that. But what does a randomized control trial say about this overall? Overall, it seems to indicate that maybe just a general blanket recommendation may not be warranted. However, there are many people that, previously had a history of colon disease, colon cancer, or perhaps things like inflammatory bowel disease, Crohn's disease, ulcerative colitis, which clearly are going to be in a higher risk category, which probably should still benefit from this. People with IBS, which may progress to IBD, maybe it may have a potential benefit. The obese are at higher risk for cancer in general, perhaps they benefit. So it's not clear if the average person who's healthy, lean, and in absence of disease would overall receive a benefit for this. There are other screening tools, a fecal occult blood test, for instance, where you just send a little poop sample in, and you can, see if you have any blood in there. That can be a screening tool. Flexible sigmoidoscopy, as Vinay Prasad points out, has a better data record, at least as far as randomized control trials go. So anyway, colonoscopy, age 50 or 45, is a recommendation based on solid randomized control trial? Probably not. All right. You guys take care. We'll talk to you soon. Let me know what you think. Let me know what you think about colonoscopy. Have you had one? Are you going to have one? Did you work in a colonoscopy lab? What have you noticed over time?